Hi everyone, welcome to Center of Balance Live. I'm Sunampua from Center of Balance, the acupuncturist. Well, today is a good day. It's a very hot day out there. It's very hot. We're in Hamilton, New Zealand. Well, our topic today is how is glaucoma treated? So how do you treat glaucoma? Well, I'm going to give you the general treatment if you go to doctor, Western doctor. We are acupuncturists and Chinese medicines. Well, you can say it as an Eastern doctor, isn't it? We don't call ourselves doctor in New Zealand. We're not allowed to say that. We are practitioner. But in China, in Mandarin, it's always called Pan Yi Shi, like doctor, right? So there's the difference between China or Malaysia and New Zealand. The system's different. Well, now, anyway, we're gonna talk about glaucoma. If you suffer from glaucoma, if your family suffers from glaucoma, this is something that you want to share with them with this video. And I'm pretty sure if they suffer from that, and they probably know what are the options they're going to get regarding treatment. Now, yes, today we're going to talk about Western medicine treatment for glaucoma. Now, I'm going to share with you Chinese medicine treatment, and as well as acupuncture, and as well when we talk about acupuncture treatment, it's actually more for acupuncturists, because I know a lot of people following my YouTube and as well as Facebook in our page. You are an acupuncturist. Well, those are for you. We'll probably talk about that tomorrow. And further on, we're going to talk about this mainly for my clinic, for patient. Now, of course, for acupuncturists as well, if you want to know how to do acupressure point for glaucoma, it's simple. It's very simple, right? Very, very simple. I get my patient do it every day, at least once a day, and to manage glaucoma. So there are a lot of things that you can do. A lot of things you can do, right? Not just Western medicines. What the goal of either for Western medicine or acupuncture, the goal of glaucoma treatment is to reduce IOP. What is IOP? It basically is just the pressure in the eyes, right? To stop any additional eyesight loss. So typically, your doctor will begin treatment with prescription eye drops. Very common, very common. If this don't work or more advanced treatment is needed, your doctor may suggest one of the following treatments, which is medications and surgery. Well, medication. So several medicines designed to reduce IOP are available. These medicines are available in the form of eye drops or pills, but more common is the eye drops. So your doctor may prescribe one or a combination of this, right? And I do have patients, there are side effects of the eye drops, particularly for eye drops, and more. It's very common. So it may work, it may not. Okay, but anyway, as I said, there's a lot of options: medication, eye drops, and if you choose to do this, there are acupressure point that you can do at home. The acupressure point, and I'm gonna show you the day after tomorrow. Right, I'm gonna show you all this. So stay tuned. Come back and watch it. Further on, right? If the eye drops doesn't work, if the pill doesn't work, what else? Further on, they will suggest surgery. or if a blocked or slow channel is causing increased IOP. Your doctor may suggest surgery to make a drainage path for fluid or destroyed tissues that are responsible for the increased fluid. Treatment for ankylosing glaucoma is different. It's very different. Why is that? Because this type of glaucoma is a medical emergency and requires immediate treatment to reduce eye pressure as quickly as possible. Well, it doesn't mean that you have to go with the ankylosing glaucoma, you have to get surgery straight away. Now, they still give you the drops, the eye drops, the pill to start with. It's very common. And when you do that, and if it doesn't work, they suggest, hey, surgery. Right? That's always the standard process in here. So medicine are usually attempted first to reverse the ankylosing, but this may be unsuccessful. Yes, maybe some unsuccessful. What we receive for those patients come for acupuncture, and normally, well, if the eye drops are working well, they won't come to see us. I won't come to see us, okay? Unless it's a side effect of the eye drops, or unless the eye drops doesn't work, and they looking for another options. They come to us for acupuncture, or they go for surgery. But of course, when they come to us, which means they want to avoid surgery. That's what it is. So a laser procedure called laser peripheral iridotomy may also be performed. This procedure creates small holes in your iris to allow for increased fluid movement. So basically, it just put a hole in there and to allow that the fluid has more space. So if it's more space, and it reduces the eye pressure, so the pressure won't cause the optic nerve damage. So that's how it actually works for that. But there's no guarantee again for surgery. The pressure may still up one day because you just increase some space for it. But when the fluid increase, and it still stay in your eye, it's not going away from that, then, or there's another blockage performed, then you're going to face glaucoma again. You're gonna lose your version. Right. Hi, how are you? That's it for today, and I hope you gain some knowledge from here, from today's talk, live video. I've been stopping the discontinue the glaucoma topic for a while, and I carry on because I've been doing other stuff and I've been busy for preparing my March 3 days live webinar. Now, if you're an acupuncturist and your time's coming to learn the real skill of acupuncture and get instant relief acupuncture, which I'm going to teach balanced method acupuncture as well as global balance acupuncture, local balance, global balance, as well as balancing pose method. With the balancing pose method, you're going to use pose, make a diagnosis, then according to the diagnosis you can put needle in and to treat it. And in the future, if you learn this in the future, I'm going to teach you some herbs. It's simple. According to the pose diagnosis, you can prescribe herbs straight away for a patient. Right? Stay awesome, and I'll see you tomorrow. Bye bye.